Hello everyone. In daily life, we use ice packs for physical cooling. In fact, besides cooling, ice packs also help stop bleeding and relieve pain in injured areas, and control the spread of inflammation. In this lesson, we will learn the correct way to use ice pack. The specific procedures are as follows. 1. Assessment. The environment should be clean, with suitable temperature and humidity for the elderly. Assess. Evaluate the elderly person's disease and level of consciousness. Understand whether they can cooperate with the procedure. Locally assess the elderly person's skin condition and mobility. 2. Determine care needs. Based on the assessment results, if the elderly person has fever or local pain, local congestion, inflammation, or similar issues, an ice pack should be used to reduce temperature, relieve pain, or control the spread of inflammation. 3. Planning. Use an ice pack locally to reduce temperature or relieve pain for the elderly person. 4. Implementation. Required items include a homemade ice pack or a chemical ice pack, a cloth bag, towel, thermometer, and temperature record sheet. The caregiver should be neatly dressed and wash their hands thoroughly. Bring the items to the elderly person's bedside. Communicate with the elderly person and explain the purpose of the procedure. When placing the ice pack, first wrap it in a cloth bag or towel and place it on the elderly person's forehead or top of the head, or on major blood vessel areas of the body surface, such as both sides of the neck, armpits, and groin. During use, ask the elderly person how they feel every 10 to 15 minutes, and check the condition of the ice pack. As well as the skin condition where the ice pack is applied. If the ice in the pack has melted, it should be replaced promptly. "30 minutes after using the ice pack, body temperature should be measured again. When measuring temperature again, use a body part that was not in contact with the ice pack. Then tidy up the items and help the elderly person into a comfortable lying position. Straighten the bedding. For item disposal, if a homemade ice pack was used, empty the ice water, hang the pack upside down to dry. Let the ice pack air dry. Blow air into it and seal the opening, and store it in a ventilated, cool place. Wash and dry the cloth bag for future use. If a disposable, chemical ice pack was used, dispose of it according to medical waste classification. Wash hands. Record. Record the body temperature measured on the abdomen. 5. Evaluation. During and after the procedure, observe and ask the elderly person. Ensure no discomfort and that the environment is clean, items are properly placed, and disposal is appropriate. Precautions for using ice packs include: 1. Avoid contraindicated cold application areas, such as the back of the head, auricle, and scrotum, as these areas are prone to frostbite. Also avoid the precordial area, as cold applied here may cause reflex arrhythmia. Cold on the abdomen may cause diarrhea. Cold on the soles not only causes peripheral vasoconstriction, but also impairs heat dissipation, but also may reflexively cause coronary artery constriction, potentially triggering angina. 2. During cold application, frequently observe and ask the elderly person about their condition. If the skin under cold application becomes pale, bluish, or purple, or if there is shivering, pain, or numbness, immediately stop using the ice pack. 3. Cold application should not exceed 30 minutes, to avoid secondary effects. 4. Before use, check the ice pack for any damage, to prevent leakage that could harm the skin. 5. Closely monitor the elderly person's condition and temperature changes. When body temperature drops below 39 degrees Celsius, remove the ice pack. Post-cooling temperature should not fall below 36 degrees Celsius. If any abnormalities occur, report them promptly. That concludes our lesson on using ice packs. Thank you, everyone.